A new state bill would restore prescription drug benefits to state retirees.
Yeah, as we have been reporting, those benefits were stripped away at the start of this year after a years-long legal fight was lost.
Fox 45's Rebecca Pryor has more on the financial toll the new federal plan is taking on the state's oldest retirees.
Yeah, this change to a new prescription drug plan has been a long time coming. It was first passed by the legislature in 2011 and then was held up in court until recently. But now this new bill aims to walk all of that back. After more than 3 decades working as a constable for the District Court of Maryland, 78-year-old Thomas O'Rourke is one of about 55,000 state retirees stripped of his prescription drug coverage this year.
The state of Maryland has left us old folks behind.
Sending the price he pays for certain prescriptions.
Cost me about $50 a month.
Skyrocketing.
Now they're going to cost me about $400 for 3 months. For her asthma that she really has to need when she has an episode, and now it costs her for 3 months $748.
Between his insulin and his wife's inhaler, he estimates they'll pay about $4,000 more a year on the federal plan.
That's a lot of difference.
To help absorb the higher premiums and out-of-pocket costs, the state providing a health reimbursement arrangement, allocating $750 to individuals and $2,000 to families. But critics argue the program still isn't enough for retirees with high medical expenses, especially if their medications aren't covered under Medicare Part D and don't count towards their deductible. O'Rourke adding, beyond the price is the principle.
But it's not the dollars as much as the heartbreak, that you're promised that all your life. It's not fair, it's not right, it's not moral.
Just kind of pulled the rug out from under them.
Delegate Ryan Naraki agreeing.
If folks think that at any point in time we could just change your benefits package, it's not a good way to run a government.
Knowing many people took lower paying state jobs with the better benefits in mind, Naraki introducing House Bill 356, which would restore prescription drug benefits for all state employees hired before July 1st, 2011.
I understand where we are with respect to our budget situation. There's no one that's more concerned about our budget than I am. But I also think that when you make a promise to folks, you have to keep that promise, period.
It's a bill that's been up for debate before, each time seeing little success. Typically, repeat legislation also receives a sponsor-only hearing, meaning retirees like O'Rourke.
If they'll take our drugs away, they'll take anything away, I think.
Wouldn't be able to make their voices heard in Annapolis. And if the bill hearing is sponsor-only, retirees will still be able to provide written testimony to lawmakers. Naraki says the Appropriations Committee will likely bring this bill up for discussion sometime in mid-March. In Baltimore, Rebecca Pryor, Fox 45 News.
I'm Mary Bubala. Thank you for watching. Here's another video for you to watch. Also take some time to subscribe to our YouTube channel.